Well, in any healthcare setting, informed consent is considered one of the primary safeguards for a person's autonomy. So if I'm making a healthcare decision in collaboration with my healthcare provider, I need to be properly informed to consent to that decision. And so informed consent has a number of, there's three primary things that informed consent must have in order to be truly informed. And it's one, it must be voluntary. It must have, the person consenting must have the mental capacity to consent. And there must be disclosure of appropriate information at a level that is understandable about the intervention, which includes both the potential benefits and the potential harms. And the person has to have an opportunity to ask questions and have their questions answered.
Mm-hmm.
And so once that is all done, then a person can go, yeah, I'll sign up for this. I understand the vulnerabilities, I understand the potential risks, but the benefits really seem like something I want to expose myself to that risk for. And they're making that decision themselves. And so with psychedelics, it becomes a little tricky, right? Because psychedelic experiences, especially if a person has never had one before, can really open us to the unknown. We can't necessarily predict what is going to happen for a person in a psychedelic experience. So there's kind of this, understanding problem where people coming to psychedelics without prior experience to just be told about what it might be like, you can never truly explain that. And so we have to do our best, and we have to consider, what is the level of information that's going to be appropriate, because even the consent process is part of the extra pharmacological factors or context that is going to influence the outcome, right?
Mm-hmm.
So, so again, we have to keep broadening our lens to remember everything that we say and do and interact with this person before their psychedelic experience is going to impact their psychedelic experience. So if we say in their consent, like, you might become very afraid that you're going to die, you might remove all of your clothes, you might want to run away, or present all of these situations that might sound really terrifying to a person, that might create a lot of fear around what they're stepping into. So, but at the same time, we can't skirt around some of the potential extremes of emotion and activation and disinhibition that may happen under psychedelics. So it's a really important piece to think about. I am a person who believes that therapists need to have experiences with the medicines that they're working with, because it makes them a more trustworthy guide, in my opinion. I would not guide someone up a mountain that I've never climbed before, and not that the terrain is going to be exactly the same. In fact, that is the one risk of having prior experiences as a therapist. If you've only had one or two, you run the risk of then projecting what your experiences was like onto what the client is going to experience, and perhaps unconsciously maybe suggesting what it's going to be like and creating expectations that may be absolutely wrong, but yet are going to then contribute to the frame that the person takes into the experience, and therefore impact the experience significantly. So we don't want to do that, but we want to have a knowledge of the potential landscape, of the types of extremes and the in more generalities, what it might feel like to allow one's consciousness to be altered away from ordinary consciousness and then to come back, and when we know that we can go there and then come back, we can share with our clients, from a place of authority. You might have moments of terror or bliss, and whatever happens, you're going to come back.
Mm-hmm.
And it's these types of things that I think are really valuable to be able to share from one's personal experience, to help create that safe container and that sense of trust with the client, which is so important. Again, we know if a client goes in with enhanced trust, there will be more openness, and then they're more likely to have a mystical experience and a positive experience. Again, shaping the experience.